The traffic in front of these two children's hospitals in Beijing is much busier than normal. Watching parents rushing in crowds with trolleys carrying children of all ages is heart-wrenching. Since October 2023, influenza and mycoplasma pneumonia infections in China have gradually intensified. Some regions have seen an increase in the number of patients in hospital emergency departments, particularly with respiratory infections among children. The pediatric outpatient volume in Beijing has been operating at a high level for over a month.
My child's test results show positive in both mycoplasma pneumonia and influenza A. I think her illness is much serious than previous years. I came with her dad. He's now laying up in hospital. He told us there were still 200 patients before us.
According to the Joint Prevention and Control Mechanism of State Council, it is expected that influenza will reach a nationwide peak during the winter and spring seasons, and mycoplasma pneumonia infections will continue to be high in some areas in the near future.
Experts explain that children are susceptible to mycoplasma for a period of roughly 3 to 5 years. For adults, it's twice as long.
但是从我们临床角度上讲，
However, from a clinical perspective, there is no significant difference between this disease and the mycoplasma pneumonia we have seen before. The severity of the illness also shows no particular changes compared to the past. Treatment follows conventional methods, and the vast majority are effective.
Experts say the predominant strain of influenza in the north regions is still influenza A, especially H3 and 2, and it is similar to the strains from previous years.
而且他们做了一些药敏的实验。
Drug sensitivity experiments show that these strains are sensitive to commonly used antiviral medications. Therefore, it's just that there are more cases this year, but from the perspective of the virus itself, there has been no mutation.
Monitoring shows respiratory infections diseases, primarily influenza, has been on the rise. Analysis suggests that the recent increase in acute respiratory diseases in China is related to the overlapping presence of various respiratory pathogens.